News Channel 5 network and millions of conversations. This is one of millions of conversations.
Welcome to the Millions of Conversations show. My name is Samar Ali, and I'm going to be your host today. Joining me is Dr. Rachel Thornton, who's going to be leading us in a conversation about our healthcare system and how we transcend divides through medicine. Dr. Thornton is a practicing pediatrician with extensive experience across the United States and around the world. She has worked in the White House, at Johns Hopkins University, and is currently with Nemours Hospital. She has a PhD in health policy and management, where she honed her skills around how to strengthen the relationship between doctors and community. I know that this special relationship between patients and providers is something that really is at the heart of so much conversations these days, and also, if I might say, is meeting people with a lot of anxiety, as there seems to be a growing trust deficit. But before we get into all of that, we want to hear from you about why you became a pediatrician. Why did you decide to become a doctor?
Well, first of all, Summer, thanks so much for having me. It is an absolute honor to be with you today. And I would just say, you know, on some level, the first suggestion about going into medicine was a pragmatic one from a mom who wanted to make sure her daughter had a gainful future and was able to have a successful life. And I wanted to be a conductor.
Wow.
And my first trip onto a college campus as a child, she suggested to me that women can learn science and medicine, and I should really consider a career as a doctor. And then as soon as I started to think about medicine, I immediately thought about children. I mean, I was one myself, and so of course children were kind of my favorite people, but I've never wavered from just a real desire to heal children, and frankly to be part of families, be a supportive force for families that are caring for children. What I love about my job is, you know, it is an extremely rare occurrence to be in an environment where all of the children, you know, all of the people involved in caring for children have anything other than their 100% best interest in heart. And so even when we don't see eye to eye, I know that the caregivers and parents and grandparents and communities around the kids I serve are all looking for the same thing I am, which is for them to have everything they need to achieve their best health.
Well, and I think that's where some of the anxiety is coming from for people, because they're trying to find those answers and they're finding it really difficult, especially in this information ecosystem. And tell me a little bit about how you found health systems evolve in your almost 25-year career now as a doctor.
Well, I mean, there's the obvious things like the role of technology. My signature evolved to be as illegible and expedient as possible, because I was a resident when we still had to fill out all our orders on paper charts, and was really part of the transition to electronic health records at my institution.
Did that make it better? Did that transition make it better?
There are a lot of positive things about being able to legibly read the work and the notations and the information left by your colleagues in the care of patients. There are a lot of wonderful things about being able to access seamlessly and pull in information from other sources. I would just say, like, one example in everyday pediatrics is we really want to know what kids need from us. If we get a new patient in our practice, we want to know, do they have all the vaccines and all the things they need to be up to date? And with good electronic health record systems and registries and information exchanges in states, it can make getting that information a lot easier. It can make getting information about where a loved one's, you know, where a patient was previously hospitalized and what they did for them there. So there's a lot of positives. And certainly I think we're in this evolving technology ecosystem where things are moving so fast that, you know, we're still learning how to catch up with them. So if I had to pick one thing that's a major shift, it would definitely be the role of technology in the way that we doctor. I also think we're also in the midst of trying to understand how we do as much as possible for entire communities.
Right.
And think of people as more than, you know, the disease that brings them to my office today, and think about them as whole people.
Right. And so you mentioned vaccines, and I know that that's a hot button issue these days, and I don't want to get into whether or not you're for vaccines, you're anti-vaccines. That's not the point. But the point here that I'm wanting us to kind of dig into a little bit more is, why is there so much of a debate around vaccines right now? And what is at the bottom of some of that, which gets to how people are feeling with regards to an agenda or the trust between the healthcare provider and the patient themselves, and what they are receiving as to whether or not they trust that information and that recommendation that's coming from their physician, one way or another.
So, you know, the way that I would answer this question is really the most humbling and just moving aspect of being a physician is the window we get into some of the most challenging and difficult aspects of people's lives. And I have never met a physician who takes that lightly. That is a sacred trust and a sacred relationship that we have. And we know how precious and valuable it is that someone is willing to disclose and tell us things that they may not, frankly, even their closest family members may not realize they're struggling with. That information for us is how we help them on their journey of healing. Knowing the details of someone's symptoms or of how long they've been struggling with something is integral to understanding how we can best support them, and may even be integral to deciding what the diagnosis is. I think about parents as thirsty for information in a very similar way. And I would extend this to anyone who sees as one of their callings, one of their something that tugs on them in life, as caring for children and nurturing and supporting children to live healthy lives and be safe and in settings that help them thrive developmentally. Information is critical. And, you know, we always joke as a parent, which I did, I was a doctor before I was a parent. I had a manual to be a doctor. I never had a manual about how to be a mom. I thankfully had the benefit of, you know, knowing a lot of science and things like that about child development, but it still doesn't answer all the questions for you. And so in those ways, I see doctors and frankly the whole community in healthcare that's helping support the health of populations as a tremendous source of information.
Well, you talked about you have a lot of questions. Well, we do too. And we're going to be looking forward to getting to some of those questions after the break. Well, welcome back to the Millions of Conversations show. We're here with Dr. Rachel Thornton talking about trust and medicine and that sacred relationship between healthcare providers and patients. Rachel, you mentioned that there are a lot of questions that parents have, and that you found yourself in those shoes yourself when you moved from being a doctor, being a pediatrician, to being a patient. And I was hoping we could talk a little bit about what is public health exactly? You know, you have a PhD in the subject. That's something we hear a lot about, but if you had to break it down in simplistic terms, what is public health, and how do public health initiatives impact information and how health systems function?
So public health to me is a separate but interlocking part of how we keep communities healthy. I think of hospitals and clinics as places where frequently people are going when they have an immediate health need. Pediatrics is a little different because we are focused on prevention and focused on equipping families with information sort of just in time for when they'll need it. We call it anticipatory guidance. It's letting you know how to prepare for the next stage of your child's development by making your house safe for them, or lowering the crib, or watching out for, you know, electrical sockets and those types of things. Public health is how do we know what's affecting entire populations and work towards sharing information at scale that can help keep whole communities safe. A great example in pediatrics is, and it's actually one of those things that was cited as one of the 7 great achievements in the last 40 years of of the 20th century is I'm sure a lot of parents have heard about safe ways for your child to sleep.
Yes.
And the importance and safety associated with sleeping on your back.
Yes.
Well, some of that comes from public health information campaigns that grow out of, geez, we're seeing this pattern of, sudden infant death or near death in young babies, what's causing it, and sort of an investigation, and then information that gets shared to help people have the right information to make choices about what's going to be the safest way for their child to sleep. Some of it is those types of things that are responses to trends we're seeing in populations. Sometimes public health is completely invisible, and I think a lot of people in public health pride themselves on the fact that sometimes when we're doing things well, you actually never know it's happening. We all get in a car and put on a seatbelt and don't think twice about it now. And the whole process that got us to a point where that was sort of standard practice had to do with public health. We go to a restaurant and we trust that we're going to have a meal that doesn't make us sick, that we're not going to be eating food that's expired, or that no one in the staff is going to have a disease that's going to communicate something to us. And that's public health in action. It's what they prevent that we never actually see.
So what are some of the challenges to public health today? What do you think are some of the things that we should be working on and looking into that are in the interest of public health?
Well, from my perspective, health is a holistic experience of communities. It is a response to our shared desire to be happy, be thriving, be healthy. And I guess the biggest thing from my perspective is this notion that it's separate from us, and that it's something imposed upon us as opposed to something that we kind of co-create and that we value because of what it brings to our own lives. I mean, it's the same way I think about information sharing with parents. I'm not expecting everyone to make the same decision about every recommendation I give them, but I am expecting that we're all going to have good information to work from to make the decisions that are best for us and our communities.
So has that become more challenging just because that's become a challenge in general across society and medicine is not immune to it? Is that what you're seeing right now?
I think that that's a fair assessment. I mean, I think we know about all the different ways people get information and the extent to which I'll give youth as an example. We know that sometimes access to, social media and information can present challenges in terms of discerning what's going to be most helpful for us. Sometimes the things that are most alluring are not necessarily the most fact-based or the best sources of information. And I think people are really struggling to get good information that's going to help them make healthy decisions. And that's why that sacred relationship between doctors and patients, to me, is just it's so sacrosanct and so important, and something.
Do you agree with me that it's been impaired over the past several years?
I think there are a lot of ways, both because we tend to have superhuman expectations of doctors. And because there are so many facets of what's happening in healthcare that go beyond the doctors, the nurses, the healthcare providers, and the patients in the system, it's really hard for people to make sense of why it's not working for them. And the person they know is, and the figure they know that represents medicine is the physician. And I think we have a responsibility to help people understand what's happening, and also to rebuild trust, or to build trust for the first time in some communities that may have, legitimate reasons for having reservations.
So knowing all of that, what are some of the things that keep you up at night?
Well, I'm an advocate for getting good sleep. It's important to your health, so I try my very best not to let things keep me up at night. When I think about those kind of challenges that, or I don't know, wicked problems that we really need to tackle for a healthy society, to me, it really does come down, Summer, to how do we bring people back into a conversation where they have access to high quality information and have help and support in discerning.
Is it access to high quality information, or is it to trust that information? Is it the access or the trust piece?
Well, I guess I think of it as trust, but also being able to discern fact and fiction. I do think that's gotten a lot harder in the current environment because how popular something is may not reflect the extent to which it's really good information that will help you make the most healthful decisions for your family. I do think this is why sometimes people have an abstract challenge with physicians, and yet when they talk about my doctor and my nurse, that still is a sacred, trusted relationship, and that is something I think we have to lean into in those actual human touch points. We can't do everything at scale. Some of this we really do have to do one patient at a time in those conversations with one another.
Yeah, and I know one of the things that you do is you focus on the intersection of child education and community development. And tell us a little more about why you decided to zero in on that intersection.
Well, I think it's sort of natural for pediatricians because we know that, you know, most children under most circumstances are born with a ton of healthy potential. And certainly there are many children who are struggling with illness and injury and disease, and we want to have a healthcare system that serves all of those needs. At the same time, we want a system and we want an environment that really nurtures and allows that healthy potential of childhood to blossom throughout the entire life. And we've discovered a lot about all the things that accumulate and can threaten that healthy potential over the entire life and cause chronic disease. I just think we don't always spend enough time talking about all of the possibilities, all of the positive interactions, all of the ways we can kind of pour into that cup and fill up children's opportunities to be healthy and to overcome obstacles for a healthy adulthood. So that to me is like where education and community fits in.
Love that. I love that part about so many children are born with healthy potential and we need a system that nurtures it. More after the break on the Millions of Conversations show. Thank you. Welcome back to the Millions of Conversations show. I'm here with our special guest, Dr. Rachel Thornton, where we're talking about the potential of health in our children and investing in systems that help nurture that potential. Dr. Thornton, can you give us an example of a stellar program that you've seen that helps do exactly that you think more of us should be leaning into?
Sure, absolutely. So one example at Nemours Children's, where I currently work, is something that the National Office of Policy and Prevention helped to develop and disseminate called the Better Together Family Cafes.
And Better Together Family Cafes.
Yes. Okay. You can go to their website. It's healthykidshealthyfuture.org, and there's more information about it. It's really highlighting, again, what you said about education being such an important conduit to children's health, and particularly focusing on early childhood education settings like daycares, nurseries, preschools. And the cool thing about it is it's a series of conversations between families and staff that focuses on the kinds of things in our communities and in our homes that we can do to foster positive interactions and create those opportunities for learning and promoting healthy practices, like the value of having dinner together as a family, the value of engaging in activities together, and how to do that with children, especially in those.
Is access to food part of it too?
I think access to food is a huge part of, to high quality nutritious food is a huge challenge for a lot of families. It's certainly something that healthcare delivery systems are taking more seriously to understand how we can be part of the solution and understanding how to connect people with those resources. It's huge for children. There are some really critical programs that for another day we could talk about, focused on early childhood nutrition, on access to healthy food that are integral. Is there a list that
we can go to that has maybe some of those programs online?
Yes, definitely. So the Women, Infants, and Children's program, which is specifically focused on pregnant women and children under age 5 who are food insecure or have limited income, has been a huge source of improving maternal child health outcomes. The Supplemental Nutrition Assistance Program helps families connect with food who need additional supports and helps. There's also so many things in local communities. I mean, in rural communities, understanding how local community farms or other collectives are working to ensure access and kind of create those cooperative opportunities. I think those are the kinds of things that would be great to learn about. You know, what are you doing in your local community that we could learn from? And those are really important programs. You know, other things I think are really important is really understanding how you can support your local community overall. So for kids, I think about all the things that support development and health, like community resources where you play sports or where you get together for you know, just fun activities in a safe environment that's developmentally appropriate with trusted adults around to supervise. Finding ways to get kids off their screens and out in the world. There's so many things we can do locally, in addition to kind of, you know, checking in with your local health department resources about programs they want to support.
So as a healthcare expert and also as a doctor yourself, what is something that you wish that every patient knew when they were coming in to see the doctor or coming in to see their nurse practitioner or going into a minute clinic?
Yeah, so first of all, in those primary care relationships, which I treasure because I'm a primary care pediatrician, so I'm a huge proponent of that longitudinal relationship. I want every patient, every parent to know it is a relationship. Okay. It is a long-term connection and interaction. And you have the ability to help create and to, you know, you have the empowerment and agency to build that trust with that clinical provider. They want you to ask questions. Got it. They aren't expecting you to agree with everything. Their real pursuit is creating an environment where you'll come back to them and they can continue that partnership with you together.
Sounds like a conversation.
It's a total conversation.
Well, thank you very much, and thank you for joining us on the Millions of Conversations show. Please engage with us, take the pledge to listen, and we look forward to seeing you next time.